stay tuned. And I'm now going to pass it over to our moderator, John Sears from the Office of Academic Advising.
Wonderful. Thanks, Alexa. And thanks for everyone for joining us today. So our event today is the other side of healthcare. So we have 4 amazing Rice alumni who are working in various roles in healthcare that are not clinicians and doing some really amazing things in healthcare on what we call the other side of healthcare. So I'm going to let each of them introduce themselves, and then we'll go through a few questions so that they can share their experience with everyone. So we have joining us today Megan Hotard, Chris Chickalue, Zeenab Shipchandler, and Ken Yonda. So Megan, if you'd like to kick us off.
Sure. Hi, I'm Megan Hotard. I'm dialing in from outside the Dallas area. I'm currently a senior medical writer with Lighthouse Medical Communications. I'm still relatively new and settling in with the company. I've been with them for about 5 months. My company is originally based in New York, so I will be permanent work from home once the world does open up. And then our parent company, Lucid Group, is based out of the UK. Should I go ahead and say like a little bit about what medical writing is, or will we get into that a little bit later?
Sure, I think that'd be fine.
Okay. Sure. So basically, I'm still very junior. I have the privilege of working with a wonderful senior medical team. And together we work with our pharmaceutical clients to help them really tell their story, to help them explain their data, help them plan their clinical trials, really communicate with healthcare professionals on different aspects of their drug and of their clinical development program. And what I really like about the company that I'm with now is that we aim to be a strategic partner with our clients. So our goal really is to impact patients and impact patient outcomes. And while we might not be doing that directly, we're not treating patients, we're helping that data be communicated, and we're helping educate clinicians. And so that's a little bit about what I do.
Wonderful. Thank you. Chris.
Thank you. Pleasure to be with everybody here, and pleasure to be, contributing to this. So name's Chris Chickalue. I work for Memorial Hermann. I've been an employee of Memorial Hermann for about 8 years now. I am Chief Investment Officer. I lead the investment program, and our mandate is basically to invest the hospital's capital pool in a manner that is aligned with the hospital's mission to help the patient community in Houston. And so I took over the CIO role probably about a quarter ago. Before that, I was head of a smaller portion of the program, public markets and hedge funds. So we don't, I'm not involved in sort of regular day-to-day hospital, operations or on the clinical side. But our group is certainly integrated with the hospital, and I report to the CFO and also report to sort of committee, which is subcommittee of the finance committee. I graduated from Rice in 2001. I have fond memories of my time there. Did not know I was going to be in healthcare at all, and so this is a very circuitous route, for lack of a better term. And but I've loved my 8 years here and in healthcare, and hopefully this is my long-term calling.
Wonderful. Thank you. Ken. Oh, Ken, you're muted.
All right. Hi. Ken Yonda. I am a retired health insurance executive, spent 40 years working for big health insurance companies, from Prudential to Aetna to Humana, and then the last 11 years with a regional nonprofit health insurance company, Community Health Choice. During that period of time, got very involved in both educational type activities and trying to teach people internally within the industry and outside the industry about how healthcare is financed and how doctors get paid and how health insurance works. So now that I'm retired from that, I am both part-time on this faculty at Rice in the Jones Business School, teaching healthcare financing and health insurance, and also at the University of Houston College of Medicine, teaching medical students about how healthcare financing and payment models work. So I'm very much involved in the industry, but not a clinical part of it at all. And much like Chris, I'll have to say that when I was at Rice, I thought I was going to be a financial guy, an accountant, maybe a lawyer, but in it sort of accidentally got from Prudential's investment area into Prudential's healthcare business and totally fell in love. And now I consider myself to be an applied health economist. I think Vivian Ho at the economics department at Rice would vouch for me on that. So.
Thanks, Ken. And Zeenab.
Sure. Hi, everyone. My name is Zeenab Chandler. I'm Houston born and raised and now live in Dallas. I was an undergrad at Rice where I majored in Asian studies and minored in biochem, #former pre-med. And I earned my Master of Public Health in Health Promotion at the University of Texas School of Public Health. So before I went into independent consulting, I worked in a range of healthcare nonprofits. So health literacy promotion at a pediatric healthcare system. And then I also worked on clinical practice guidelines with cardiologists and continuing medical education assessments with OBGYNs. And now currently I'm a public health consultant through my company ZRF Group Inc. And I work mostly with healthcare organizations and community organizations on promoting public health best practices through research, training, and strategic planning.
Wonderful. Well, thank you. Thanks to all of you for those great introductions. So we'll go ahead and get started with our first question, which is kind of Rice specific. What were some of the most formative experiences that you had during your time at Rice that really helped you advance your career? And I'll go ahead and kick it off to Chris to start us off.
So formative experiences. So honestly, so I was Will Rice College and applied to Rice as an engineer and thought I was going to be an engineer. What dramatically changed my trajectory was a guy down the hallway from my dorm room who I was looking at helping him review his resume. He was a senior, I was a junior, and he was really enthusiastic and passionate about getting into finance. And after reviewing his resume and having a lot of conversations with him, I really caught the bug and decided I wanted to look at finance and consulting as well. If not for him down the hallway, honestly, I'd focused a lot of my time trying to get a job at Schlumberger and some of the active recruiters at engineering firms at Rice at the time. But after dialogue with him, doing some research, talking to a ton of Rice alumni, I decided I wanted to do something in finance. And it became a focal point for me, and did that as an internship and after business school, and I've kind of stuck with it.
Ken.
Yeah, I think the big thing for me at Rice was that I got a great liberal arts education at Rice. I was a triple major in anthropology, economics, and managerial studies, on track to take the 5-year program to get my master's in accounting, and decided not to do that and instead went to U of H Law School because I just am interested in so many things. And how that applies to my healthcare career is that when you think about healthcare, there is a big part of that which is social sciences. And in fact, I would say right now in healthcare, political science is probably more important than the actual life sciences because of all the politics of who we cover and how we pay for it and what services we should pay for and prescription drug pricing and all those kinds of things. So the fact that Rice really set me up very nicely to figure stuff out, like many people that come to Rice, they did really great in high school and, had, great resumes coming in and learned stuff, right? But at Rice really set me up to learn how to think in sort of critical thinking skills and how to analyze situations and all the rest. And that's been a big part of my career and my success and, moving to the point of being a CEO for a health insurance company, ultimately for 11 years. And now being able to say, oh my gosh, us old graybeards are not going to be the one to fix a challenging system, but we need to start teaching the younger folks coming in about all these issues. So Rice was very good at that. I would also say Rice was very humbling because, you know, you go from being one of the top students at a rural high school in Texas to suddenly becoming, you know, average at best and maybe slightly below average. I see some of my other speakers sort of probably experienced that as well. But really just being amazed at the people that you're around at Rice that really helped, you know, people that I still keep up with. And my wife is a Rice graduate. My brother's a Rice graduate. His wife is a Rice graduate. My daughter's a Rice graduate. So there's certain, you know, things that we continue to be very engaged because what a great place Rice has been for all of us.
Wonderful. Zeenab.
Sure. So two things really come to mind. I was part of the formative or founding committee for the Pancakes for Parkinson's event, which I think still continues till this day. That kind of showed me how different groups, you know, different individuals and groups can come together for a specific cause, which in this case was raising awareness and funds for Parkinson's research. And I was also a health, humanism, and society scholar. And so I worked with a Baylor College of Medicine medical ethics professor on research on the ethics of incentivizing immunizations for childhood vaccinations in rural India. So that both of those gave me a different perspective on what healthcare is, and just that leadership and publication experience really ended up being beneficial in my job search and graduate school applications moving forward.
Great. And Megan.
Hi, so a couple things. So I originally started at Rice as a PhD student in the chemistry department. And I spent about a year working in Dr. Torr's lab. And I enjoyed my experience in the lab, and I learned, you know, got more hands-on experience with the scientific process. But I didn't want to spend my career focused on one molecule or perfecting one synthetic route. And kind of one of my formative experiences was really kind of seeing what do I want to do? And I was looking at the course catalog, trying to see like what electives maybe I could take to get some more exposure to what else is out there. And I came across one of the health policy courses and did a little bit more research. And that's how I came across the professional master's program in bioscience and health policy. And what I really enjoyed about that was that it pulled together all of these aspects to addressing those kind of bigger picture questions, where if you do, you know, if you do develop this wonderful molecule, how does it get to patients? What are the economic implications of it? What are the different, just all the different business aspects, things like that, more from an interdisciplinary perspective. And kind of echoing what Ken said at Rice, I learned how to learn. I came from a liberal arts background, but that's basically what I'm continuing to do now in my profession. Some of the disease areas that I work with are hemophilia and psoriasis. And while I'm by no means an expert in either of those fields, I know how to do the research, and I know how to thoughtfully approach those topics and see what different aspects in the field will pull together in a kind of in a meaningful way. So kind of, not to ramble, but that was my formative experience, was really learning how to pivot. Like I certainly didn't graduate from Rice with a degree that I thought I would. I graduated with a master's in bioscience and health policy. But that's that process, that discerning process, and learning that it's okay to pivot was really, really a formative experience.
Great, thank you. Okay, so our next question, we'll kind of dive into a little bit more, I guess, career-specific question here. What are some good skills or certificates or licenses that you could receive in order to enter your respective fields, and how would it be possible to obtain those? So Zeenab, why don't you kick us off?
Sure. So I think overall research and evaluation skills are really important. Not just if you're planning to go into research or academia, but just in terms of, you know, understanding, interpreting clinical trials, and public health research. So everything from data collection, data analysis, data visualization now is really big with things like Tableau. All of those things are things that anybody in the healthcare field, from doctors to public health professionals, health policy, that's really important. And then in my field of health promotion and health education, there's a certified health education specialist credential, which you can get if you major in health education / promotion at the bachelor's, master's, or doctoral level. And then you also have to take an exam. And there's an advanced level, the Master Certified Health Education Specialist, which I'm actually sitting for on Saturday. So wish me luck. hopefully I pass, and I'll let you know how that goes if any of you are interested.
Wonderful. Thank you. Chris.
And so no specific degree or certificate. I'd say, for better or worse, this the investment office is more closed off, and not a lot of folks know of healthcare investment programs or that they exist and whatnot, and they don't actively recruit. I always use the analogy of, like, it's kind of like congressional or Senate related campaigns. Every 2 years or every 6 years, something kind of opens up, and the best way to set up for that is more about just proactively reaching out and looking to the Rice Alumni database or any sort of other affiliated networks you have, and trying to find contacts within these groups and staying in the loop with them, staying in touch with them, expressing your passion, making sure they know who you are, and hoping that within a time window that you are available, something opens up and you can have proactive discussions. I'd say that is easily 70% of sort of the thing that's required to do, and then 30% of it, I think, if you have a master's degree in finance or CFA or an MBA, that helps. But easily the networking aspect, because opportunities don't open up frequently, is by far the most important one.
Great. Megan.
There are different certificates available. There's different medical writing certificates and different copy editing certificates that can be helpful to kind of give you a more closer eye at written documents. In my field, for the writing positions, typically a master's is kind of the base education that they look for. There are several companies that do require a PhD or comparative years of experience. But more from the project management side of what I do, because I've project managed advisory boards and different medical education meetings, things like that. That typically is you can enter with a bachelor's or a master's. And there are additional like project managed PMP certifications and things like that, but that's more advanced in the field, and you need a certain number of years of experience, and you sit for an exam as well. And I do not have that.
Great. And Ken.
Yeah, there on the healthcare financing side, I mean, there's a number of different opportunities. There's a number of master's program in health administration. A lot of people that work in or have advanced degrees in public health masters or PhDs in public health. And what you're starting to see more and more on the insurance company side of things are people with those kinds of healthcare administration, healthcare financing degrees, those kinds of things. There's licensing requirements. Frankly, how you sell health insurance is very complex, and so Texas, like most other states, require you to actually be licensed to sell health insurance. And so if you're on the sales side, just sort of helping people figure out about deductibles and coinsurance and maximum out of pockets and all that kind of stuff, different network requirements in terms of what's covered and what's not covered is pretty complex. So there's a certification programs there. And then I will put a shameless plug in for a brand new Coursera online certification course that we just developed at University of Houston. that is in value-based care and value-based contracting. This is the movement of payments away from traditional fee-for-service to paying for value as opposed to paying for volume. And just one quick add on the data analysis side. Big data is huge everywhere in healthcare, either on the financing side, identifying people that are at higher risk stratification, risk adjustment programs. So if you're into data analysis and manipulation, huge amount of opportunities in the healthcare space, either in the insurance world or the hospital world or accountable care organizations and those kinds of things.
Okay, so my next question may not apply to all panelists, but if it does, feel free to answer. Have you ever considered a more clinically focused healthcare career at any point in time? And if so, what made the other side of healthcare a better fit for you?
So I can speak to that because I was pre-med for my first 2 years at Rice. And there are a mix of reasons why I decided to go into public health. One was lifestyle based, the residencies and 24-hour calls and just the drinking through a fire hose analogy that a lot of medical students were telling me about. That wasn't necessarily appealing to me lifestyle wise. And then I also had a very diverse breadth of interests. I did my Asian studies major because I got to take classes in basically everything, in religion, in English, film, you name it. So public health seemed like something that was more broad, that I could sink my teeth into many different things. And I also like the focus on populations, prevention, and health promotion versus, in clinical medicine, a lot of times about individual treatment. So those are kind of the factors I considered.
Yeah, I actually, when I was a junior in high school, I was pretty certain I was going to be pre-med and go that direction, and actually ended up taking a summer science training program that was done by the National Science Foundation, and started doing actually college level work and talking to a bunch of other people and realizing that practicing medicine is about taking care of individuals and the patient in front of you right now. And I'm just kind of more of a macro kind of population, I would say a compassionate person, but rationally compassionate for populations as opposed to any one of you individually. And I don't mean that to be mean about it, but it's, it's like, why do we have so many obese people, or why do we have many people with high blood pressure, and what are we doing about disparities in health? Has just simply always been much more interesting to me than what prescription I need to write for you as an individual. And so it was kind of a very easy thing for me to flex away from that. That's not to discourage anybody who wants to become a physician to becoming a physician, especially if you're going to be a primary care physician. Tremendous shortage of primary care physicians and also people that are doing mental health counseling and psychiatrists. So we need more of those people as well. It's just, I'm not one of them.
Agreed. It's a wonderful career. And it just wasn't for me in particular.
And they are trying, and I work for an educational institution that's doing that right now. It's like, but trying to find that work-life balance and trying to change what it's like to be a practicing physician, I think is an important thing moving forward. And so I'm very encouraged by the initial class at U of H College of Medicine. Is a very diverse group of people and from much more diverse background than your traditional pre-med science nerds, which I think is another important new skill for physicians moving forward.
And I think it's just important to mention, you don't have to choose one or the other. I think having a clinical and a kind of population-based approach is really important. And that's kind of where I see myself as in that bridge zone. So the more people who are doctors who know about health policy or know about health insurance or know about the financing side, I think that's really valuable. So you can look into those dual degree programs too.
And I still have friends from Rice that have spent their entire career looking at that one molecule, that one virus or whatever, and it's like, oh my gosh, I don't know how you can do that for a whole career. So it's but it's important that somebody do that.
Yeah, it's important, but it was definitely like I was more inspired by the big picture for sure.
Great. Okay, so my next question, what are some opportunities that students might be able to pursue to get involved in healthcare policy or healthcare administration, maybe perhaps here in Houston or elsewhere? And let's see, who wants to
there's tremendous. I'm very involved in lots of policy discussions and stuff. And so there are, one thing that's great about Houston is that all you have to do is show up, and it's easy to get involved. There are organizations that focus on particular areas. So, the Cancer Society, the Heart Society, the Heart Association, the MS, different advocacy groups are very active in the Houston area and throughout the state of Texas. There's also, opportunities. One of my favorite organizations is called Doctors for Change, and they will take us even if we're not doctors. We can still be part of Doctors for Change, who are trying to think differently about organizations. There's there's a policy things that are going on both at Rice, a number of different organizations, as well as at U of H. I'm on the board of one of the biggest policy organizations in Texas called Every Texan, which is used to be called the Center for Public Policy Priorities. So just whatever you're passionate about from a health policy standpoint, send me a note and I'll send you to the right people to be part of that.
Great. Megan.
I interned with Doctors for Change while I was at Rice, so I can definitely second that that shout for that organization. They have a lot of different committees for different aspects of healthcare, whether it's access to healthcare or healthy eating and active living, all different components to get involved in. So whatever suits your interest. And that was definitely a very formative experience for me at Rice as well, getting to work on their county judge survey and getting involved and seeing that perspective and how that data is gathered and how they took that information and made different policy recommendations from that. In terms of I don't have a lot of other recommendations for how to get involved in healthcare policy or administration. One thing that I have kind of enjoyed, so since getting into the field that I'm in, I'm not necessarily directly working in healthcare policy. So one thing that has kind of helped me is following different like news alerts and things like that, just to kind of stay informed. And I've also really enjoyed getting to follow some of the Baker Institute seminars and things like that. Just even though I'm not directly working in that right now, staying involved and staying abreast of what's going on has still kind of given me that, has whet my appetite for that still.
Great. Zeenab.
Yeah, so I'm not, focused on health policy, but I'm definitely very aware of it. And my sister actually did the Archer Center Fellowship through University of Texas, and that's where I did my master's as well. So they have like a management, policy, and community health department. And throughout the UT system, people can apply to this Archer Center Fellowship, and you can spend like a semester in Washington, D.C. And work on health policy issues. So that's a great opportunity. And I would just say, our state capital is Austin, so a lot of the policy that's happening is in Austin. So if you're able to check out what's happening in the capital, that's where you can be involved in state level advocacy.
Great. And Chris?
So I don't feel qualified to comment on the policy side, given I'm not plugged in there. That's why I've mostly, kept quiet. So if it's okay with you, I'll abstain from that.
Sure thing. Awesome. Well, we're going to go ahead and wrap up then with our last question. Given how uncertain times are right now, what words of encouragement or advice might you give to everyone to approach this time, with confidence moving forward? And Megan, why don't you start us off?
In terms of words of advice, I feel like some of the best advice that I've been given, especially during this time, is have patience with yourself. I know there's a lot of pressure to feel like you have to have it exactly figured out and you have to have your career mapped out and know exactly what, the next few months look like or the next year looks like. And it's okay if you don't have that all figured out. I was briefly unemployed during the pandemic for a bit with my prior agency. I was furloughed and went through that very uncertain time of applying for jobs and things like that. And it's hard, and it's really hard. It's hard to push through and keep that motivation and know your worth. But kind of have the confidence in the background that you have, and the background that, especially that you're getting at Rice, and it'll work out. I know that sounds a little cliche, but it will, and the timing will work out when it's meant to.
Chris.
No, I second everything Megan said. It's my general advice is just particularly, certainly in normal times, particular times like this where there's a lot of uncertainty. My strategy when I was an undergrad and I found paid off was the original comment I made is just reaching out and leveraging the alumni database and someone where there's some measure of degrees of separation. You never know who take up your offer to catch up over Zoom or do lunch or coffee, socially distance, to the extent the person requires that, of course. But doing it as extensively as you can. For me, in normal times, when the economy had a more surer path, back when I was an undergrad, paid off, and I think it still matters today. Not everyone will take your offer. Some people are busy, but try 10 people. One person takes up your offer. They might introduce you to another person who thinks your profile might be a fit. You just never know, and so that's what I'd say. To encourage you to do, and just keep your head up. And part of why volunteered and raised my hand to do this is just paying it forward, because I've been there before, not knowing what I wanted to do and what would be a fit, and I went through a ton of no's before a couple of people accepted my call, and I'm fortunate to be where I am today. So keep your head up and know I've been there before. A number of other people have been there as well.
Great. Zeenab.
So agree with my predecessors, I guess, but also would like to add that, there are some positives that you can focus on right now. Us being at home, I feel like, ironically, I'm more connected with people in some ways, who are all over the country, people, public health consultants like myself. I've met so many. I joined Twitter, and met many people through there, joined different affinity groups on Facebook or LinkedIn. And so I feel like more in the loop because I've done all of those things. And there's conferences and webinars like this, and a lot of them are free. So, take advantage of that. And also, like, now more positions are flexible or remote. So that's an exciting thing for me as a working parent. And then the final thing is that, people actually know what public health is now. So unfortunately, that's a consequence of unfortunately what we're all going through. But I think the funding, the infrastructure for public health hopefully will increase. And so maybe there are going to be more opportunities in the field.
Great. And finally, Ken.
There are definitely many opportunities, and but there is also zigs and zags, and I certainly over my career there have been intentional and where I made changes and other times where changes were done to me, right? And so that's just kind of life in the world. So if you're interested in the broad area of healthcare, there's just really infinite opportunities. There are just so many jobs available, and whether or not you are interested in data or if you're interested in working with patients. I see there's a thing in the chat from somebody who's an occupational therapist. Huge need for people in physical therapy, occupational therapy, in areas of home healthcare services, in healthcare finance. I mean, just wherever you want to be, there are opportunities. And heck, right now there's tremendous volunteer opportunities for helping with vaccinations, and that's a way for you to get to meet people, as other speakers have said. You just get to know people, and you get to be in networks and network through, and it may take 2 or 3 steps in that process, but you'll find the right people to talk to. And I spend a lot of time talking to students and former students and other people exactly about that. And I have 1,800 contacts in the healthcare business in my electronic Rolodex. And so always happy to help anybody connected to Rice who wants to talk more about it and find other people to talk to.
Great. Thank you all very much. I'm going to turn it over now to Alexa to give us our next steps.
Awesome. Thank you so much to our panelists for a great discussion. So just a couple of reminders. We would really love your feedback as we are continuing to improve our virtual events. And so there'll be a survey that Carrie will put in the chat that will be an opportunity for you to share any feedback or ideas for future sessions. And as you've seen, the power of the Rice Network, we've got some incredible alumni that are, Rice is with you after you graduate, while you're at Rice and beyond. And so I encourage you to take advantage of the Rice Network by joining us on Sally Portal, which is Rice's professional development and mentoring platform. So if you'd like to continue these conversations, this was a partnership with Rice Alumni in Medicine. So Carrie, would you like to introduce our virtual speaker?
Good, thank you so much. So it's nice to see everybody here today. My name is Carrie. I work in the alumni relations team with Alexa, and I also support our affinity groups, which are interest-based groups, which Rice Alumni Medicine, or also known as RAM, is one of them. And so Ishmael Bradley, who is our current RAM president, is not able to be here live with us today, unfortunately. He is on shift at the hospital, but the beauty of virtual events has allowed him to pre-record a message for all of you. So just doing an introduction for him.
Hello, everyone. My name is Ishmael Bradley, and I'm the president of the Rice Alumni Medicine Affinity Group. Thank you all for taking the time to join the virtual panel discussion on alternative careers in healthcare. I would also like to introduce you to our association if you haven't heard of us before. The past year has been challenging for all of us, especially those of us who work on the front lines. Despite all the challenges of 2020, RAM has continued its mission of connecting alumni across the various fields in healthcare, be it medicine, dentistry, community health, or research, and in supporting students. We dedicate a significant portion of our resources and our time to mentor and encourage current undergraduate students who have expressed an interest in healthcare. We run a mentorship program, help students with professional school interviews, provide MCAT study supplies, and award undergraduate scholarships every year. I have volunteered with RAM since our founding and have always appreciated the work that we have done over the years. I encourage each of you to visit the RAM webpage and sign up to be a volunteer and a member. Thank you.